We need to make a recommendation to WHO, don't we? If our goal is to develop leaders who will advance palliative care, in your small groups, quickly, can you come up with one single strategy, in short, which you would recommend to WHO to advance leadership skills to make this work in our countries? So back in your small groups, we're going to give you 5 minutes.
Or new groups.
I'll be keeping you to time.
And we're going to just, if you're going to just jump in and have a conversation.
I'm looking at the groups, and I just need one of the group, we're going to just literally just a couple of groups. So would anyone like to share what they felt that their recommendation was? Any one group happy to share their recommendation? Is it all, we've all gone very quiet. I'm looking for a hand. Okay, I'm seeing a hand at the front. Thank you very much.
Thank you very much. In our group, we first of all identified the challenge that we face, that WHO will not have the powers to choose or tell the countries to choose the person because of the way they operate. But we just felt that maybe WHO can work on the framework through which leadership can, which can comment to member countries, through which leadership can be developed, and also maybe develop an indicator that can be used to monitor that. So that's where we...
Thank you. Thank you very much. Charles.
Thank you. Not sure if this is answering the question, but I don't really care. The main... I was seen with steam coming out of my ears, and the other parts of the group agreed to let me say what was making it happen. I think right at the beginning, there was a problem with what was being said because it was talking about integrating palliative care into mainstream services, and I think it should have been about integrating mainstream services into palliative care. And I'm not trying to make a cheap point, but the ultimate issue is around trying to get the values fundamentally embedded in everything that's done. And I was interested listening to Scott earlier because he, out of his patients, he will be losing one of his patients every 2 to 3 weeks. And yet, death is something that's sort of unusual in his practice. And it seemed to me extraordinary that, and I would even go as far as saying, you know, there are concepts like it is unethical not to be embedding these principles into everyday practice. I think a little bit of coming off the fence and not being so nice and saying, actually, the problems, the world is out of line with us. And I know you can't operationalize that and suddenly say, okay, let's have a major transformation of the other 99% of the health system and just make it happen overnight. But I think if conceptually we are trying to bring the world into line with us, it begins to give some hints on to which next steps make the most sense. And I suppose my big suggestion to you is see how much we can reverse that story, how much we can make this genuinely the Trojan horse in the system, where, and in case anyone doesn't know that, it was in fact a Greek horse, but that's a different story. But that's trying to put into the change process a view that what we're trying to achieve is this as normal, as opposed to we are trying to get people to accept us from outside. And I speak here with 3 degrees in economics and no experience in any clinical subject, but I really think it's useful to try and turn around the way we think.
Thank you very much, Charles. I don't know if anybody, would you like to say in response to that? You happy with that?
Well, my perspective is just hear what you're saying.
Yes.
I wish we could indeed do that. We've been trying that for 40 years so far, and we still don't have it in most curricula around the world. And the illustration of what Liliana put forward in terms of trying to make it mainstream is, I think, actually a fabulous strategy, which has just transformed the medical curriculum of a country. We've not achieved that in other countries. I wish we could make it. So I hear what you're saying. I think it's a fabulous piece. How do we do that? Because if we tell people they're doing it wrong, we get resistors.
Yes, go ahead, Liliana.
I also think this is about making relationships happen and building those relationships on a constructive model rather than creating more tension than it already is. And there's a lot of frustration. Several of us, we've been working and advocating for this for many, many years. But we also have found out that through the time when we build those relationships, things go smoothly and work better than when we go with, more confrontation approaches.
Okay, thank you very much, and thank you too, Charles.
Can I just give an example? So when we introduced the EPIC curriculum in 1999, it was launched, so it came out of a very small group of people who created it, and some of the people in the room will remember this launch. We had invited 270 of the leaders in palliative care in the US to come to the first 4 conferences, and we asked for their advice. And we asked them to review the curriculum. I will promise you, 80% of them walked into the room with their arms crossed like this, and you've dared to do what? And you're going to impose this on me? And this was the palliative care community as resistors. And it melted because we asked them to give us all their feedback, to respond to components. It melted, and it became a very widely accepted curriculum. So again, it was about consensus building, but be very careful.
Thank you very much. I'll take this lady here.
Moira from Macquarie University.
Yeah.
Just to re-emphasize what was said about ownership, I think if we're wanting to really see changes in our curriculums, for example, they need to be owned by our colleagues. I'll just give you a small example from our setting where we've been working for some years training internal medicine graduates. When we were reviewing the curriculum, I thought we would have to argue quite hard for our bit. But actually, the cardiologist said, move us to 3rd year, put palliative care first term, first year, because they're better cardiologists if they've done palliative care. And that real value and ownership was so important. But can I make a plea that we don't just see referral as an indicator of success, but actually interventions without referral and referral if appropriate. So, and we've been trying to measure that, and in our setting, it does seem to be that 75% of problems can be managed by sort of inward intervention, supported and mentored by the specialist team who handle the complex 25%.
Thank you very much, Moira. Any other group want to share what they would consider their recommendation? Regina?
In our group, we were talking about the fact that leaders probably have a degree of being innately having leadership skills. But if the WHO is looking to develop leaders, is how do you identify and recruit the potential leaders and then providing the appropriate training? But I do think it's that thing of trying to get the right people rather than just somebody on a leadership thing. But we had no solution about how you identify the right leaders, but if somebody can figure that one out.
Okay, thank you. Okay, I'm going to take one final comment. I think it's Marie Lynch. It is? Yeah. In the back.
And taking up on Regina's point, I think you can have a right leader in one environment, but that leader can't enact the change they want in another environment. So I think one of the previous slides, you said we're all leaders, but you have to find the skills to lead in different settings and working with different people. So one of the recommendations we had was that there would be leadership training as part of the SPR. And the other recommendation, building on that word mentoring, is that there would be a mentoring framework as well to support the SPRs in their leadership.
Thank you, Mary. I'm going to take one last comment, and it's Max. Thank you.
Thank you very much, Phil. Just our comment from our group would be a direct ask to the WHO that leadership training, we would like to see it in an interdisciplinary format so that we do not train siloism, we train leaders together.
Thank you very much indeed, Max. And with that, I'm going to draw the session to a close. Can I ask your warm applause to our presenters, Liliana and Frank? Thank you.